Hi, everyone. This is Dr. Grant Garcia, one of the sports surgeons at Orthopedic Specialists of Seattle. This is a blog post for one of my good physical therapy groups, High Def. Today, we're going to talk about snow sports and snow sport injuries. We'll try to make this as brief as possible. We'll go through the most common snow sports and some injuries that we see, treatments and rehabs and non-operative treatments as well. So the first one, and this is the big one we see a lot of, is ski injuries. So, every year we see tons of people that get unfortunately injured skiing. And some of these are preventative. So, the first thing and the most common thing that I see in the office is ACL tears. And there are ways to prevent these in skiing. One, there's been some data that shows that sometimes bracing can help, especially in patients who've had previous ACL reconstructions. So if you have a brace, it may be a good idea, especially if you haven't been out skiing for a little while, to consider putting that on. And also sort of the prehab, and a lot of the physical therapy groups offer this, but this is a good option to go see your physical therapist, especially at High Def, and see if they can get you some preparation to get ready for ski season. Because I think the problem is that a lot of patients only ski for a few months of the year, or maybe 3 or 4 times a year, and their quads and hamstrings are not strong enough or not in the exact mode to get ready for skiing. I know that even though I try to work out as much as possible, when you do that first couple of days of skiing, you're pretty sore, and that's when you're at the highest risk of injury. So doing that pre-habilitation is really important. We see a lot of meniscus injuries as well. We see a lot of sprains, MCLs, lateral collateral ligaments, and those things are, the good thing is a lot of times those can be treated non-operatively, but it's good to be aware of these things and consider making sure that your legs are nice and strong before you do this. Obviously, head injuries we don't want to see, so wearing a helmet's always important. Everyone's got different opinions on that, but I think that that's a very safe way to do this and avoid a major injury to that. We see shoulder dislocations, wrist injuries, elbow injuries from falls. The key is really just not overdo yourself. If you're a blue run type of person, stick on the blue runs. Black diamond type of person, stick on the black runs. But just be aware of your limitations. And I said this before in some other podcasts and talks, but really just not overdoing it those first day or two. And if you've got a week-long vacation, take it easy the first day or two, and I think that'll help, and that does reduce injuries. Moving on to snowboarding injuries. So it's amazing. People still think you can't get an ACL injury from snowboarding, but you can, especially when you get off the chairlift or you have one boot out and you twist it. But I still see about 10% of my snow injuries or snowboarding injuries related to the knee. Less common, most commonly wrist and shoulder and head. So making sure, again, that helmet is worn. Wrist guards are really, I don't think, necessary, but just, again, knowing your limitations. Those people you see on the hill that just sort of drag down the whole way, that can be an increased risk of an injury. And making sure you have good technique. Getting a lesson or two is not above anybody, especially if you haven't been doing it in a while. And again, rehabilitation beforehand is really important. So it's something to consider in these snow sports before you prepare for them, because sometimes the months are only 1 or 2 months long, and you may have been taking it easy for the Christmas break, and then you come back and do a ski trip or a snowboarding trip and you get hurt. Snowmobiling is a big thing. We want to be careful about that, making sure we don't keep our limbs out of the snowmobile, and make sure you understand the machine. Tubing is a big deal that we see less injuries in there, thankfully, but again, just making sure that you're doing it at appropriate discretion, and that you are making sure that you're not getting out of control, because hitting a tree or getting your leg caught is always something we don't want to see. And then the overuse injuries from all these things. Cross country skiing too, you can get a lot of hamstring injuries. You can get twisting injuries from cross country skiing. It's less likely to get injured, and it's a different cardiovascular workout. And skate skiing is a really good way to get good cardiovascular workout, especially if you're nervous about starting off on regular skiing with a little lower impact on your knees. And a great option, and some patients don't know about it, and we have great options here in the Pacific Northwest to do that. There's a number of other things. We could do hockey, obviously go Kraken. And hockey injuries, we see a lot of different things. We see skate injuries, we see head injuries, we see knee injuries, A lot of hamstring injuries, sometimes occasionally surgical, but really that, again, stretching, building the strength in the legs is really important. So, hopefully this was helpful for you, and hopefully you can go out this winter and really enjoy these snow sports. Just making sure to be preventing them. Again, we don't want to see you in the office. We want to make sure that you're having a good time and not getting injured. If you do get injured, going to your physical therapist like High Def First is a great option. They can sometimes even do excellent diagnostic skills to figure out if whether or not you need to see an orthopedic surgeon. Obviously, if you're concerned, we're always happy to see you and evaluate your knee, shoulder, elbow, whatever joint it may be. And just having a good winter, and enjoy the holidays. Take care.